All right, well, thank you to Sages and Rob and Corey. So getting patients through the door, this is really building off of these two great talks that we've had before. Disclosures, none. Obligatory 7 seconds. Nice to see everyone here. So the basic steps, we're going to go through a lot of material. Really building off of Dr. Choi's information, knowing your market, building your brand, reaching the patients to whom you're going to provide the quality care at all stages from start to finish, and then spreading the word, because that's a huge part of marketing as well as growing, and not only you spreading the word, allowing your patients to, and we'll talk about some tools. So the big question, if you build it, will they come? This is one of those fun AI-generated images. Understanding your market, you like that, right? I figured. Understanding the market, who needs the reflux center? So this is kind of the basics, right? Starting off, what motivates people to seek the care of your reflux center? Which other providers will collaborate? I noticed we didn't mention ENT in there, which my ENT doc, we work very closely together because just like Pulm can send you a lot, ENT can send you a lot. Understanding your local competition. So are you a golf swing away from your competitors or 50 miles? That plays into how you're going to market yourself and your expected growth. What sets you apart, as well as who is your target audience for when you are marketing? Are you going to be reaching out to your colleagues, to your patients directly? So we'll talk about that a bit. So in terms of marketing, branding, you can put together your own website, and we have some tools at the end of this presentation. Or some of your major hospitals already will build a website for you. You can be on LinkedIn, of course. Social media, that becomes huge, of course, in this day and age. You have to make sure you know your organization's policy of if you can post certain videos, because that can attract patients to your site and then to you. But some organizations don't want you doing that for the sake of HIPAA, even if you scrub all the data off of it. Testimonies from your patients, of course, you guys all know that, as well as any educational material too. So that starts to build your brand as who are you and how good are you? Are you providing care from start to finish? Branding can also look like, so Dr. Choi mentioned the word branding a lot. It can look like, how do you treat your patients? How does your staff treat your patients and interact with them? How easy is it to get an appointment, or how quickly can surgery be scheduled, the outcomes that you have, as well as your follow-up care. So you have to answer that question. Before you start any of this, I'd say answer the question, what identity does your practice have, and what story does it tell to the people that you want to attract to work with you, but also to the patients that you want to help? The patient experience becomes a big deal with this. You can see on the right, the ratings are available to everyone. So the things that will impact the ratings, which patients will then look at, which then plays into the growth of your practice, and as well as the marketing, everything really affects the ratings from start to finish. I have been dinged on patients not being informed of wait times, and so I had to work on that personally. Meanwhile, providing excellent care from meeting the patient and caring for them, that goes a long way. That's another AI image. So none of these are copyright. If you guys want to take them, go ahead. This is a doctor knocking door to door. How do you find, or how will people find out about your newly formed reflux center that you've put all this time and money and effort and blood, sweat, and tears into? Are you going to receive referrals from trusted sources? Are the patients going to hear from word of mouth, or even from their primary care doctor, other healthcare professionals? Or are they looking you up online, which we'll see 94% of people do that, so you have to have that presence as well. Elaborating on that, you can go into indirect advertising. So if you are working on getting your name in Google, some facilities that are more remote, all your patients do is type in, I have reflux, where's the hospital or where's the doctor, and your name pops up. If it's a little more competitive, you may have to work with Google and their search engine optimization, especially there's even a separate subcategory for local SEOs where you can kind of tailor the keywords so that your name pops up. If you're not within really the first 6 results, people aren't looking at it. Billboards, we've already seen a picture of that. I see those around where I live. Commercials, I see TV commercials. That feels, I think, to a lot of us surgeons, that feels a little superficial to try to do this direct marketing or this indirect advertising. But you have to be open to anything in order to grow your practice. The direct advertising, so the pay-per-click, is the sponsored ads you see on the top of Google, so on the right-hand side, whereas the SEOs are more below that. So the pay-per-click, if you need to go into some of that advertising online, definitely look into that. There are also direct mailer campaigns. I really haven't seen any reflux centers doing that yet, but I'm sure there are. That's an effective method. For example, where I live, I looked up how much would it cost to get a billboard, and their buy-in is about $5,000. So you can see that it becomes a little pricey if you are a smaller single entity. But if you have a big organization who's willing to support you and buy into your desire to help the community with reflux, ask for that up front. So social media, this becomes a big topic, right? So everyone has their devices. This paper, which focused on plastics, talks about how over 2 hours a day that was a year and a half ago, people are spending on their devices. So you can leverage that to push content to them, and then they share that with others. You can see on the right-hand side of this graph, so this was obviously specific for plastics, but you can extrapolate it to your practice, how certain age groups will be targeted with different social media platforms, the keywords that you use to share and spread. So that's this whole like Instagram, TikTok, Snapchat, don't discount that as a possible tool for you as well. So referrals, so when I was starting out, I took my referral forms and a basket of fruit or chocolates or something, and went and met the family doctors, the GI doctors, like shaking hands, giving them the referral form, saying, fill this out, fax it to me, we'll figure out the rest. A lot of bigger facilities have that kind of intra-facility referral option too, which is great, but there are some around me where we get these handwritten, easy to do referrals. Circle my name, send it in, we'll take care of the rest. This whole word of mouth thing, I think that's where most of us think of as our marketing and how we're going to grow our practice with word of mouth. So we'll go into that. Don't incentivize it. Hey, I'll give you a free surgery if you tell 5 of your friends, or that's illegal. So the word of mouth, I found this online as well. So 3/4 of patients are identifying the word of mouth marketing as a key influencer. And I know in my practice, most of them hear from someone else who hear from someone else. 94% of patients are looking online to review you. So make sure you have a positive presence there. You can control that to some degree. You can even see here, the majority of people will trust that online review just as much as they trust their mom telling them about you and the services you offer. And 1 in 6 people, all it takes is 1 in 6 reviews for them to form an opinion. So it doesn't have to be a plethora of reviews. Just be careful about what feedback, I guess, the patients are giving you. Also, word of mouth. What are the colleagues saying about you? I know there's one GI doc that I work with who just sings the praises and loves sending people to our center, and it's just this fantastic rapport. So work for that. It's not just the patients you want to work with, but your colleagues. So now we're getting into some of the tools. I have a background in kind of building websites in the past. I really enjoyed doing my own HTML code. Not a lot of people know that. So now you can just plug it into GPT. I asked it to output an HTML code with a friendly prompt of a professional surgical service, all this stuff, and it will give you that HTML code. If you don't know that, there are services available that will talk about like drag and drop and different fees that you can look up. For the graphics, a lot of the graphics here have been used by AI, so use AI to kind of make your website a little more friendly, your social media presence. Also hiring professional photographers, all that. We can talk about that. There are texting services. So here's a big one, I think. On the right-hand side, you can see different texting services and different costs. So after a patient has an encounter, you can ask for that feedback. I traditionally ask people come into me, they say, I had such a great experience. The hospital is great. The nurses are great. Your office is great. You did great. My surgery is great. I will straight up ask them for a review. I'll say, go to the website and leave me that review so that others can see it. People have a bad experience. I'm not asking them for a review. I'm telling them we're going to address that. I'll go to the nurse manager, things like that. So that's how you can have some control over your your market, your growth, your identity, your brand. Here's just a template for the texting, ChatGPT. Here's a template for emails, ChatGPT. You don't need to be a genius in wording, just plug it in, go. So in summary, another AI image there. In summary, you have this new reflux center. You're offering these unique services. The patients need it in your area. You've done your research. You know it's going to do well. You're going to do well. You're a great surgeon. Now go advertise, create the excellent patient experience that they deserve, and then ask for those reviews. Thank you very much.